Imagine slowly losing your vision without any pain. You might notice that your eyesight is getting worse, but by the time you realize something's wrong, some of that sight is gone forever. Scary, right? Well, that's what happens to people with glaucoma. It's a condition that sneaks up on you, and if left unchecked, it can steal your vision bit by bit. But here's the frustrating part: once glaucoma takes away your sight, you can't get it back. The good news: there are ways to keep it from getting worse. If you or someone you know has been diagnosed with glaucoma, you probably have a lot of questions, concerns, and fears. But understanding your options can make a world of difference. What exactly is glaucoma? Let's start with the basics. Glaucoma isn't just one disease but a group of eye conditions that damage the optic nerve. This nerve is like the cable that connects your eyes to your brain, transmitting the information that lets you see. The main cause of this damage is high pressure in the eye, but sometimes, glaucoma can occur even when eye pressure is normal. The problem is that glaucoma can go unnoticed for a long time because the damage happens slowly and without warning. And once it starts, it can lead to permanent blindness. So, if you've been diagnosed with glaucoma or someone close to you has, your first reaction might be panic. You're likely thinking, how bad is this? What do I do now? It's totally natural to feel worried, but with the right treatment and management, you can protect your vision. Eye drops, the most common first line of defense. Most doctors start by prescribing eye drops to lower eye pressure. These tiny drops pack a punch when it comes to slowing down glaucoma's progression. But here's something that might surprise you: eye drops don't cure glaucoma. They also won't bring back any lost vision. What they do is help lower the pressure in your eyes, protecting the optic nerve from further damage. There are two main ways these drops work. Some types help fluid drain out of the eye more easily, like prostaglandins and myotic agents. Others reduce the amount of fluid your eye produces, such as beta blockers or carbonic anhydrase inhibitors. While they are effective, these drops aren't without side effects. Blurred vision, stinging, itching, redness, and even headaches can come with the territory. Some people may even notice changes in eye color or energy levels. But if the idea of putting drops in your eyes every day sounds like a hassle, remember, these are your eyes we're talking about. Losing your vision is a far bigger problem than a little discomfort from eye drops. Oral medications, when drops aren't enough. In more severe cases, or when time is of the essence, doctors might turn to oral medications. Acetazolamide is one such pill that rapidly reduces the amount of fluid in the eye, lowering pressure in an emergency situation. You might not hear about this option often because doctors rarely prescribe pills for glaucoma, but when they do, it's usually serious. Acetazolamide can come with its own set of challenges, though, including nausea, fatigue, or even that strange pins and needles sensation in your hands and feet. For some, these side effects might be manageable, but for others, it could be a deal breaker. The point here is that while these medications are powerful, they're not always a long-term solution. Laser treatment, a middle ground. If eye drops or pills don't quite cut it, laser treatment might be the next step. It sounds futuristic, but laser therapy for glaucoma is actually a fairly common and effective way to lower eye pressure. The laser helps fluid drain more easily, reducing the pressure inside your eye. One common type of laser treatment, called trabeculoplasty, is non-invasive and relatively quick. After the procedure, you might feel some soreness or notice swelling, but these side effects are usually temporary. It's not a cure, and it might not work forever, but for some people, laser treatment can delay the need for more invasive surgery. Surgery, the last resort. When everything else fails, surgery becomes the final option. Now, surgery might sound frightening, but it can be life-changing for people with glaucoma. Surgeons can perform different types of operations depending on your specific situation. One common surgery, trabeculectomy, involves creating a small opening in the eye to allow fluid to drain more easily. Another option is glaucoma implant surgery, where a small tube is inserted to help drain the fluid. Then there's the newer approach, minimally invasive glaucoma surgery, MIGS. As the name suggests, it involves smaller cuts and lower risks. While surgery can be a game changer, it's not a cure-all. You still won't regain any lost vision, and like any surgery, there are risks involved. Soreness, swelling, or even cataracts can develop post-surgery. But for many, the possibility of preserving the remaining vision makes it worth the effort. Common questions people have about glaucoma. At this point, you might be thinking, how long will I have to deal with this? Can glaucoma just go away? Unfortunately, the answer is no. Glaucoma is a lifelong condition. But with early treatment and careful management, you can stop it from getting worse. That means regular checkups with an eye specialist, following your treatment plan, and staying on top of your eye health. Another question people often ask is, can I live a normal life with glaucoma? The answer is yes, you absolutely can. More than 90% of people who get the proper treatment can maintain a good level of vision for the rest of their lives. The key is to start treatment early and stick with it. Why consistency matters? You might be wondering, why does it seem like so much effort? Well, when it comes to glaucoma, consistency is everything. Think of managing glaucoma like maintaining a car. You wouldn't skip oil changes or ignore a check engine light, right? Just as with a car, regular maintenance of your eye health is crucial. Regular checkups and treatments are the only way to keep your vision from getting worse. If you don't take glaucoma seriously, it won't take long for the damage to set in, and by then, it might be too late. Takeaway: glaucoma treatment is about control, not cure. Here's the big takeaway: glaucoma treatments aren't designed to cure the disease or give you back lost vision. The goal is control. You're trying to preserve the sight you still have. Whether it's eye drops, pills, laser therapy, or surgery, these treatments are like safety nets, helping to keep your remaining vision intact. And while that might not sound as reassuring as we can cure it, it's a lot better than losing your vision entirely. Conclusion: your vision, your responsibility. Glaucoma is one of those conditions that doesn't give you a second chance. Once vision is lost, it's gone for good. But with early diagnosis and proper treatment, you can slow down its progression and keep seeing the world clearly. So, if you or someone you love is facing glaucoma, don't wait. Take action, stick to the treatment, and stay vigilant. Your vision is precious, and it's worth the effort to protect it.